morning, I'm Tim from Full Function Remedial Therapy, and I'm here today to talk about knee pain. I've got a couple of clients at the moment who are experiencing knee pain, one as a result of knee replacement and the other as a result of meniscus damage and arthritic changes through the knee complex. However, generally it's a mechanical issue that's built up over time that has led to this sort of situation. And the knee is a very complex part of the body, and there's so many muscles working on the knee that even if you have a structural issue like arthritis or a meniscus tear, or you've had a knee replacement, there's an awful lot you can do to help treat yourself to loosen that knee up. So if you had an injury or a replacement, generally what happens is your mobility gets restricted because of the injury or the surgery. And then you have an extended period of time where that knee is not moving freely. As a result of that, you get this muscle hypertonicity or fight against the movement of the knee because the knee is so used to working in a mechanically compromised position, or because you've had groups of muscles like the calf and the hamstring or the quads or the tibials at the front fighting against each other because one of them is tight and the other one can't free itself enough to get free movement of the knee itself. So if you are having knee issues, it can be from a number of reasons, structurally as well as posturally or mechanically, but there's a lot you can do yourself to help free that knee up by working on the muscle groups that activate that knee. So I'm not going to go into all the reasons why your knee may be getting sore and tight at the moment, because that's a whole other video in itself. What I am going to show you is the exercises you need to do, or the rolling or the self-treatment that you can do to help get your knee back to full function. So let's start. One of the first problems you find with the knee is the structural mechanics of walking themselves. Instead of our feet being straight like that, we have our feet turned out. As soon as we turn our feet out because it's more comfortable, we get an externally rotated hips, but you can see now my knees are facing out that way. So as we walk, we roll off the inside of our foot and the strain comes up through the medial part of the knee. Now if we walk with our feet straight where they're mechanically supposed to be, we have this force running right up through the middle of the knee, not like this. So, because we've got the external rotation of the hips, to fix the knee, we need to get these hips so the feet can come forwards. So when we walk or when we do stuff, the pressure comes up through the middle of the knee and the hips, rather than the actual part of the hips and the knees. So we need to get rid of the external rotation of the hips to allow the knee to be neutral. So the easy way to do that is with a glute stretch. So if you hop on your back, have your knees bent, you take one leg up, place it on the other knee, and you pull this towards your opposite shoulder like that, and you move this foot out to the side. You're going to get a stretch through that glute. You can just relax. If you don't like moving that leg, you can just grab your leg and twist it over. But having that leg resting on the knee allows you to move that leg outwards that way, and you're pushing on this, getting leverage on that hip, and you're stretching the glute area. So the knee goes to the opposite shoulder, the foot moves out to the side, holding on to that other foot, and you get that really good glute stretch down the side. So by stretching the glutes often, then you're going to get a release of that contraction of the glute, which will help alleviate that external hip rotation, which is putting the knee in a mechanically compromised position. A lot of big words. What it means is stretch the glute to loosen the hip. So when you stretch, you want to hold the stretch for about 30 seconds to a minute. You want to use your breath to relax. You want to feel it stretching in that glute. So if I can do it this way, I pull the knee to my opposite shoulder, I move the foot out that way, and you're going to feel the stretch down to this glute area here. And you hold it for 30 seconds. Make sure you relax everything, so you can tense up when you're stretching. Put your head on the ground, pull out the arrow. Stretch it there. That's where you want to feel it. So you hold it for 30 seconds, and you go back to the other one. You do it again. Put that leg out. Stretch it for 30 seconds to a minute again. You should feel a little bit better this time because you've already released it. Once you've done that one for 30 seconds, go back to this side and pull it over. that's loosened up and good. Now, the muscle that tries to fight as our hip is externally rotating, so our feet should be up, and don't pull out. These muscles down the inside of the leg are trying to correct that and pull you back again, so they get really tight. So these muscles is they attach down here on the tibia, on the inside of the leg, that makes up the bottom half of your knee. So we need to loosen these muscles up. We want to do that, to sit in the old butterfly stretch, feet together, just let the legs go down. It doesn't really matter if the feet are close to you, but far enough away, you can push down. It helps if you've got your back up against the wall, so if you put your back on the wall, like so, stops you having to try and sit upright while you're pushing down on the knee. Again, push down, nice and gently, relax, take the stretch to discomfort, not pain, and hold it for about 30 seconds to a minute. If you can, do it twice if possible. So we're stretching, you feel it down the inside of the leg. If you want an alternative to that, you can pop your legs out as far as they will go, switch yourself up, and then lean forward. Again, you'll feel it stretching. You'll really feel this one down into the knee itself, as these adductor muscles and the medial hamstring muscles which attach down here on this tibial head, pull tight. So just lean slowly forward. So it's up to you. I find this one to be very effective. Some people have trouble getting their legs too far apart, so it makes it uncomfortable or not workable for them. So either stretch this one or feet together and pushing down. Now, got another big muscle that runs down the outside, or it's actually a ligament, this band called your ITB, which attaches here and runs down. If this ITB, and runners will know about this, you talk about the ITB tightness all the time, if that ITB gets tight, attach it down through here, again, it restricts the movement of the knee. So we need to loosen that up. The best way I've found to do it without too much pain is with a bit of pressure. Now, a lot of people recommend rolling, and you put the roller under there, you hop on it and you roll along it. I find rolling to be painful, and because it's painful, the body fights against the action of it. So if you have the same principle but wind it back a little bit when you use a yoga mat or a rolled up towel, you lay it on the ground and you want this part of your leg to be lying on it, and you're just stacking your weight on it, just like that. And then the bottom leg, you kick out. As you kick it out, you're going to feel it might hurt my knee crack just as we did that. The ITB band releases. Move it a bit further down your leg. Again, put this weight on top of it, this leg on top of it, nice and sideways. You'll feel just this. So sometimes the pressure itself is enough just to help release that ITB. If you want a little bit more, you just kick that leg out. Oh, that's where it hurts. Let it come back in. Don't lift your leg up and kick up here. Try and drag that foot across the ground. But again, if you don't like the kicking, you can just rest with it. If that hurts enough there, you can move it up a little bit higher. The ITB runs from the hip all the way down to the knee, and you just rest on it. Again, so the resting is going to be uncomfortable, but it's a lot better than rolling on it where the body fights. So by just resting and allowing pressure to ease that muscle, rather than rolling on it, and the pain is so great, you just fight to relax all the way through. So you come in here, again, place into the knee itself. So we're just releasing this tightness of the ITB, which locks the knee and doesn't allow it to flex and extend. So we just let that rest into there. It might take 30 seconds or so. Generally, the rule of thumb is when you rest on it at first, it's going to hurt, and then you wait for that pain to dissipate by about 30%, and then you move it up to the next squat and do the same thing. Again, if it's hurting just doing this, just the pressure is fine. If you find it's not quite enough, just throw that little kick in the end. It's a bit of a pin of the muscle and a stretch of the ITB at the same time. Really helps loosen it up. So we stretch the glute to try and stop that external rotation of the hip. We stretch through here to allow that muscle to loosen up a bit, and we release the ITB. Now we're getting down to the hamstrings on the bottom of the leg, which attach on the underneath of the tibia and fibia disc here, so across the knee. So that's a major part of the flexion of the leg. So you need to loosen them. Sometimes you can find just by rolling back and forwards like this, Don't let the leg drop out, and then you only ever treat the outside of that part of the leg. You want that foot to be upright. Get on the inside of the leg as well. So you support yourself with your arms. You sort of sit up, put all your weight on that roller, and roll down, and roll back up again. Now you don't have to stay on there, be big static like this. You just adjust yourself, put on the hamstring, push yourself up, get your weight down, do a nice slow roll down, all the way to that sit bone, and then roll back again. Then you can readjust yourself. You can roll all the way down, all the way down the hamstring. Get a lot of length. As you're doing it, don't tighten the leg up so it's up here. You've got that leg tight, it's not going to do anything. You need to relax the leg, let the hamstring be soft, and then you roll through that hamstring. So you're releasing all these hamstring muscles that act on that knee. As you get into the knee cavity, you're going to feel a little bit sore right behind the knee. These are the attachments of the tibia and fibia in through here. So you just rest the leg on there again. You can rest it on there, roll it back and forwards. This sort of wobble, so you're not going to put much, you're not lifting your weight up there. Just wobbling your leg back and forwards, breaking up all those adhesions on those typical femur heads underneath the knee. If you want a little bit more, you push yourself up, then you roll into that calf. So you're rolling the calf into the back of the knee. This is where you're going to feel it, especially if you're really tight and that knee's being locked in this external rotation. You're going to get it here, your muscles get set in that pattern. So we need to break it up. So the rolling just to there, let it sit. If it's too hard in the rolling curves, just let pressure work. So just pick yourself up, let the pressure work on the calf, let the pressure work behind the knee, pressure work behind the hamstring. If you can roll and it's variable, just sort of wobble your leg back and forth. You need to break up the muscle adhesions behind the knee that are restricting that knee movement. If this hurts, don't do it. Just stick to the roll. Down the hamstring. Good if you separate it in two areas rather than trying to start down the calf, roll the knee, roll all the way up to the hamstring. It becomes too big a movement. So you can do the hamstring like so. And you can work behind the knee, like so, and you can work the calf, like so. So break it up into two. Don't forget, roll your foot out, have your foot straight, roll it to the inside so you get all the compartments of those muscles behind the knee. As we do this, and loosen that up, that knee can start to move around a lot better. So even if you have meniscus problems, if you have arthritic degeneration, not a problem. If you've got arthritis, movement of the joint is one of the best things you can still do for it. But if it comes, because you get pain in the joint, you stop using the joint. You stop bending it and flexing it, you sort of block it out, and you just have it mainly immobilising yourself because any other action seems to cause you pain. So you just sort of gradually try and get that movement happening, break that up again. That'll help release it. And flex it, all right, that back, and you just grab your leg and flex it in. Straighten it out, flex it in, straighten it out, flex it. Work the muscles, don't take it. If it hurts in you, don't try and push it more. Again, if you've had knee surgery or knee replacement, don't try and force the flexion into it. You can pack up under here with your hands, down on it like that, or you can use a rolled up towel or rolled up pillowcase, put it behind your knee, give yourself a little bit of an object to use to help mobilise those tibial and fibular heads. Just put my hand in there, just like that, and pull it down. Put your whole fist in there, but again, just a little tea towel rolled up behind there, will be fine. It's nice, gentle movements. Not hurting yourself, all the way out. Bend it. If you move that knee, synovial fluid starts getting lubricating the joint, which will also help the movement. You need that knee to move. Good. We loosen up the OITB, we roll the hamstring. We can stretch the hamstring as well, keeping that foot up, back straight, leg out in front of us, just lean forward. Don't try and touch the toes. Make my back straight and lean forward. I can't reach the toes. If I bend it away, I can reach the toes. So the act of reaching the toes itself doesn't actually add to the stretch. So have your back straight, lean down, and work to the feel of the muscle. If it feels stretchy there and it's slightly uncomfortable, that's where you want to start. You grab your leg and pull yourself down onto it. But we need to get those hamstrings stretching. As you let your foot roll out, you're disengaging these muscles on the inside of the knee here, and they're not going to get a stretch. So you want to keep that foot upright, knee upright, give the knee a little bit turned in, back straight, and stretch down. Again, when we're doing the stretches, hold for 30 seconds to a minute. Look at both sides, foot upright, lean forward, pull yourself in, don't hurt yourself, just go to discomfort, hold it for 30 seconds to a minute, and go back to the other one. Do the same thing. Now, we have this muscle that runs to the front of the shin here, tibialis, and it's a big mover of the knee, big player in the movement of the ankle. We need to release that. So if you've got a massage gun, you can massage gun down it, you get a bit of oil, and you can rub it. You get a rolling pin, you can roll down it like that. Use the roller on it. If you can bend the knee, you can get it like this. You can kneel on it, and you can use that like that. Roll down the front of that chin. Now, you're holding my weight with my arm, my whole weight on it. This muscle on the inside of the shin, you're loosening that up. You get that one. If you get a massage gun, probably the easiest thing to do because you can hear a massage gun up and down that tibialis. Also, massage up and down to the inside of the calf. Not so easy to get. Feel these muscles down through here, they hip flexors, responsible for stabilising the ankle. You just pop your fingers inside there, you'll feel this shin bone. Just pop off the shin and you'll feel that little groove there. Just pop your fingers in there and move your ankle, your foot up and down. Feel that really tight there, move up a little bit. So once you've worked down inside this shin here and loosen up these flexor muscles, we need to work on the ankle itself. If we are standing with our hip externally rotated all the time, our ankles and feet are going to be out that way as well. They get stuck in this position, driving the knee facing out this way, rather than having our feet forward and having our knees mechanically neutral forwards. So the knee doesn't work in isolation. It's acted on by the hip, it's acted on by the foot. You've got a knee in the middle, the foot affects it, the hip affects it, it doesn't work in isolation. So to get this knee better, we have to loosen up the ankle and loosen up the foot so it's mobile and not locked, externally rotated. One of the best ways to do that is with a little aerosol can. So grab yourself a seat, put the aerosol can on the ground, just place your foot on top of it, in the arch of the foot. So it's not on the balls of the toes, it's not on the heel, but anywhere in that arch itself. Right under your knees, almost at 90 degrees, and you just lean into it. So again, we're not rolling. Oh man, that hurts. Ow. We're just picking a spot, pushing down. It's going to be uncomfortable. Don't go into pain, just into discomfort, and then let the body relax with that pressure, so that the foot gradually elasticizes. Instead of being like this and tight, it just relaxes and elasticizes. We loosen up the plantar fascia at the bottom of the foot. We're getting the ankle so it's not rocked up like this, it's straight and down. And then we just rest it. You do it when you have a cup of tea, cup of coffee in the morning. Very easy to do. Do it a couple of times a day. Make sure you do both feet. Find a spot in the arch, push down on it. Think about something else for a minute and a half or 2 minutes while you just let that relax and mobilise or elasticize. So the other thing we need to do is get some flexion in the knee, get some movement in the knee. If our hips are turned out all the time, the feet kind of get stuck like this and we waddle rather than walking. So we need these ankles to flex. But in an ideal world, if you've had good range in your knee, it's not all you're going to have because you might have had a knee replacement. We've got meniscus trouble, or you've got arthritis, so flexion of the knee might be a problem. So I'll show you the ideal way to do it, and then we're going to work back from there. So what we want is flexion of this knee so the foot is straight. We just come down over that leg, and we're getting flexion and a stretch through the back of the calf by doing this. So this builds ankle neutrality and mobility and flexion. want to be able to bend your knees is a bit of a hindrance. So you can do two things. You can have a chair, and you put your foot on the chair, you rest your hands on the arms of the chair, and you come forward that way, or have the knee over the toe. Have your foot out like this, it's got to be straight, knee over the toe, you get as much flexion as there as you can. You can drop the heel off the back of the seat, have the balls of the toe on the seat, you hold on there, and you get some flexion that way. Trying to drive the knee that way. So it's not so much down, it's across. So you want flexion, this ankle to flex. If all of that's too hard, you can just do the most basic calf stretch ever invented. Great lunge, make the foot straight, driving down at the heel, driving your hips forward. You can have a wall in front of you if you like, so you can put your pressure on, and lean back into it, and you'll find that stretch through the calf. So to get ankle flexion from there, you just come back a little bit and bend at the knee. Push the knee to the ground and try and pull the ankle flexion up. So the calf stretch it out, and come back and bend it down. Stretch it out, hold it for 30 seconds or so, then come back, get the ankle flexion through the knee. Straighten and flex, straighten and flex. Make sure that's straight and not out there. That's what we're doing. This is how we walk with our feet. We don't want to do that, we want that foot straight. So, a lot to take in, a few points to take with you. You can't treat the knee in isolation to the hip and the ankle. They all act on each other and they all play a part in any dysfunction that has occurred. So to treat the knee, you need to have a hip that is not externally rotated, and you need an ankle that is mobile and not externally rotated, because that locks the knee out externally rotated. So to fix the knee up, you can't fix the knee if once your knee is good, your foot and your hip are both pointing out that way, because your knee is going to go straight back to that way again. So you need the hip and the ankle and the knee to be treated as one. You're going to work on all the muscle groups around the top of the thighs, so your hamstrings, your adductor muscles that run down the inside of the leg, your quad that runs along the top of your leg, and the ITB that runs on the outside of the leg. And then you're going to work on the muscles below the knee, the calf muscles, the front of the calf, then the tibialis, on either side of the shin, and along the back of the calf. And into the actual knee complex, the back of the knee itself. Just by using a roller, rolling those muscles out, wobbling back and forward. If you've got a massage gun, that would be a great benefit to you. I will do some videos on how to treat yourself with a massage gun down the track. But at the moment, all you need is a roller, an aerosol can, some stretching, and just some mobility exercises, just to get that knee moving. You need all those muscles around that knee to be moving freely, for that knee to move freely. So you can do a lot, even though you've got some sort of structural problem, meniscus, ACL, rehab, you've got arthritis in the knee. By moving all that knee joint and allowing those muscles to move freely, you are freeing up the knee, and despite the fact you've got some sort of system error, some sort of structural dysfunction, the knee will move better because the muscles aren't binded. So, good luck with all of that. If it's painful, stop. If you haven't had it scanned and checked, make sure you go to your doctor and let them have a look at it, get a scan so you know exactly what it is you're working with. But in general, loosen up the muscles, loosen up the knee, work the hip, the knee and the ankle together, and you will get improvement. So I hope you liked the video. If you have done, please drop a like, subscribe, hit notifications. If there's any other problem areas that you'd like me to focus on, drop a little link into the comments below and just let me know what it is you want me to have a look at, and I'll make a video for you in regards to that dysfunction or problem that you're having. I hope you've enjoyed the video. Thank you very much for watching. I hope it helps you get back to full function. Thank you. Goodbye.